So I'm happy to share with you some insights about artificial intelligence for body imaging. Let's start by just talking about a construct for thinking about technological impact. And in our world with imaging, we frequently are living in the lower three areas, which are technical efficacy, diagnostic efficacy, and diagnostic impact. And it is these three areas where AI is still largely functioning. We ultimately do wish to move up to having good data to assess and to ideally positively influence therapeutic impact, patient outcome, and ultimately socioeconomic benefit. But within this construct, one of the areas that I think fits in with artificial intelligence is the workflow efficiency, which actually brings up and I think integrates across all of these other elements of the hierarchy proposed by Freibeck and Thornberry. You've seen this before, so I'm not going to go into it, but the key is that deep learning really is the tool ultimately that allows for the artificial neural networks to adapt and learn and continuously learn to iterate and to improve the results. Well, brain always precedes body because of the lack of motion. And I'm just sharing with you some results from our group with Joe Malgin, in which replacing spectroscopy, which actually fails in 70% of the time, with a very time-efficient assessment using T2-weighted imaging alone, with very, very impressive results from a deep learning algorithm to determine IDH mutation status. So this is a particularly powerful example of how deep learning can be beneficial. That's a lot, simpler just in terms of the motion, the structures than the body, and that's our big challenge. The other issue, you'll notice the MSK applications are also much more robust, again, because of the lack of motion. So in the body, we're challenged by the large fields of view, the multiple different and variable organs. So we've got a liver, we've got a spleen, the bowels peristalse. So in MR, as we're doing different sequences, they'll be in different positions. And then with CT and ultrasound, the actual range of image contrast is relatively narrow. And so that begets the question in abdominal and body applications, how well can normal be defined? Because if we can't define normal, it's very difficult to then contrast and pull out what is abnormal. And I'll just submit to you